And of course, in Alzheimer's, there are three big ones. First one is energetics, and that is your metabolic support, your blood flow, your oxygen saturation, which is why so many people with sleep apnea are at increased risk for Alzheimer's disease. It's your mitochondrial function, all those things that we think about metabolically. Then it's inflammation, all these different chronic infections, leaky gut, poor oral microbiome, rhinocynal microbiomes, all of these things. And in fact, when you look at the brain microbiome, which was surprising that the brain actually has a normal microbiome, as I was always taught in medical school 50 years ago, that this was actually a sterile organ. Well, that's turned out to be wrong. And where are these organisms coming from? They're mostly oral organisms. Wow. And I should say the third issue is toxicity, and that's inorganics, organics, and biotoxins. Stress, that was surprising to me. As a scientist, it turns out that is a common player in cognitive decline. In fact, you could even follow the receptors within the brain that are associated with corticotropin releasing factor. They are associated with Alzheimer's disease. And then you have neurotrophic activity. That's your hormones, nutrients, and your growth factors. And then finally, neurotransmission. You've got to have acetylcholine to make memories. And so if you look at those six players, they are the ones that are determining, do we have enough support, do we not? And everybody who's on the wrong side of this has got too big of a demand because of things like inflammation and toxicity, and too small of a supply because of energetics and things like that. So all we're saying is, fine, we can identify now what's causing that. We can correct that. And we're seeing again and again and again, including in our current trial, just dramatic improvements. And we've just published a paper showing over a decade of sustained improvement in people with cognitive declines. Cognitive decline should be much less common than it is currently.